Hi everyone. I wanted to come on and talk about something that maybe we don't think about that can be a brutal reality when you are fighting cancer and have to go through chemo and radiation. And that is our teeth and gums. So radiation and chemo both combined really take a toll on your dental health. So a little bit of a backstory for me. I had horrible teeth my whole life. When I was maybe 18, 19, there was a dentist that I went into and I said, I'm just tired of having constant cavities, fillings needed from childhood dental issues. And his nurse felt really bad for me and did not want me to get false teeth at such a young age. So she had a talk with the dentist, and the dentist came in and he said, okay, I'll do crowns on the tops and the bottoms for $2,500 or $3,500. Super cheap considering how costly they really are, because you can spend 50 grand on them, like no joke, even back then. So I got that done, and then after I had Jetty, I was sitting watching TV, not moving my mouth at all, and I heard something just crack, and I was like, oh my god, those are my very expensive crowns. I just had a baby. Holy heck. So I went to the dentist and cleaned out my retirement account to reinvest in my teeth again, to do, I think I had like 12 root canals done and new crowns put on, and that should have lasted me for a very long time. So Jetty's 11, so I would say that this was approximately 10 years ago. And about 2.5 years ago, I was in a lot of pain, went to the dentist, needed work done. Because of my cancer treatment, they couldn't do a lot, but they did what they could to get me out of pain. And then my teeth just started breaking. So not all of my teeth are under crowns. I have like a few on this side and 1 or 2 on this side on the bottoms that are not covered. Actually, there's 6, I think, total teeth that are not covered on the bottom with crowns. All these teeth, though, in the middle, they're all covered with crowns, and they've been really hurting off and on for some time. So I go to the dentist this morning, and he's like, we got to just pull all your teeth. And I'm like, in your 40s, and you hear people, dentures, they don't fit right, people can't eat with them, like you hear all these stories. So he's like, we got to get clearance from your doctors in order to pull these 6 teeth, and then I would just have these and nothing back here. So I've been having a lot of issues swallowing lately. Like, I'll get this choking sensation in my chest, so I have to really chew my food, and so that is really going to mess with that, and so that's scary. And then I contacted my vascular and cardiologist doctors, and they were like, yeah, no, you are way too high risk of clotting, so you can't go off your anticoagulant medications, blood thinners, in order to have this until I have an operation where they put stents through my veins and my legs, because I have this rare May-Thurner syndrome. So he's like no-go on the teeth pulling right now. So I have some time to think about it, but like, and my dentist is amazing, and he's going to pull the teeth for free because he's the bomb. Dr. Ryan in Sarasota, he's amazing and great guy. We have a lot of fun laughing, even when we're doing horrible things. He is the only man that can halfway shut me up. With his hands in my mouth, I can still talk because it's me. I can still talk. So I have fought in the past my medical and my dental insurance, because when does the dental issue become a medical issue when it was a medical problem that caused the teeth issues? Nobody wants to pay. Like, not even $1. They do not want to pay. However, I feel like as cancer patients, when we're getting these treatments that cause these other illnesses, side effects, comorbidities, whatever you want to call them, I feel that our medical insurance should cover this, because dental care is super expensive. It's super important to our overall health. And it just is crappy that there's no laws or regulations at all about dental care for adults. Like, there's no help available. So that's where we're at. I can't get my teeth pulled. I gotta deal with the pain. A lot of them have already broken off from radiation and the chemo effects, and it's just one more pain, one more problem, one more thing that costs money, especially if we really wanted to do something about it, like to get like more of a permanent fixture in my mouth, like thousands of dollars. Even the cheapest way, it's thousands of dollars. So I don't know. I just wish there was some dental reform in the whole conversation of health insurance, because it's important. Like, we can't live without our freaking teeth. We're gonna live on pudding, like Jello? Like, no. It's important. We need to talk about and fight for these things, because it's just not fair that we pay all this money into insurance and then, no, we don't want to cover that. No, we're not going to cover that. It doesn't make any sense. I would also like to take a moment to look at my hair update. Like, it's getting definitely longer. It's rainy out. I'm outside, and I have frizzy hair for the first time in my entire life, because I guess it's curly hair problems. And I wanted curly hair my entire life. I was like desperate to have curly hair, especially when I was younger. And I have curly hair now. And I like it. Don't get me wrong, I do like it. But it comes with frizzy hair on a rainy day. So if that were my only problem in life, man, I would be over the moon ecstatic. But it's not. Thank you for listening to me. Please like, subscribe, comment on my YouTube channel. I greatly appreciate you all. I love you all. Have a good day.